So hello everyone, welcome to my another video. So today we'll be discussing about the intermediate acting non-depolarizing muscle relaxant called VECURONIUM. So what is VECURONIUM actually? So it is a monoquaternary aminosteroid non-depolarizing muscle relaxant. The ED95 of VECURONIUM is 50 mg per kg body weight. Then the onset of action is within 3 to 5 minutes and the duration of action of VECURONIUM is within 20 to 35 minutes. I am repeating it for once again that VECURONIUM is a monoquaternary aminosteroid and a non-depolarizing muscle relaxant. And the ED95 is about 50 mg per kg. The onset of action ranges between 3 to 5 minutes and the duration of action ranges between 20 to 35 minutes. Now let's look at the metabolism of VECURONIUM. So the VECURONIUM drug shows both hepatic and renal metabolism. In case of renal metabolism, what happens that the approximately 30% of the dose appears unchanged in urine, and in case of the hepatic metabolism, it undergoes deacetylation to form 3-desacetyl vecuronium, 17-desacetyl vecuronium and 3,17 desacetyl vecuronium. So let's look at the metabolism for once again. The drug VECURONIUM shows both hepatic as well as renal metabolism. In case of renal metabolism, approximately the 30% of the dose appears unchanged in urine, whereas in hepatic metabolism, the drug VECURONIUM undergoes deacetylation to form 3-desacetyl vecuronium, 17-desacetyl vecuronium as well as 3,17 desacetyl vecuronium. I hope it is clear. Please have a note of it. Let's look at the other points too. The hepatic metabolism increases lipid solubility and hence facilitates biliary excretion. So now let's look at the systemic effects of the VECURONIUM drug. So what happens in the cardiovascular system? VECURONIUM is a cardiostable drug because of the lack of histamine release and vagolytic effects. So this is a very important point that VECURONIUM is a cardiostable drug, and due to which reason? Due to its lack of histamine release and vagolytic effects. Now the acid base changes are same as with the other muscle relaxants. We already looked at that point earlier too, that in case of acidosis there is increase in duration of block, and in case of alkalosis there is decrease in the duration of block. And the one more important point over here, that in case of hypercarbia there is increase in the duration of block. Hypercarbia means there is increase in the carbon dioxide level in bloodstream. You already know that, so please have a note of it. What happens at the hepatic system? In case of hepatic dysfunction, there will be prolonged action because bulk of the metabolism is done in the liver. In case of renal dysfunction, there will be prolonged action as well, and there is dose dependent cumulative effect too. Then the other point, there is decreased dose requirement in elderly. I am repeating it for once again that in case of hepatic dysfunction there will be prolonged action because bulk of the metabolism is done in the liver. In case of renal dysfunction there is prolonged action as well. Dose dependent cumulative effect is also seen, as well as decreased dose requirement in elderly is also seen. In case of obesity, it causes increase in the duration of block. It is one of the most important point mentioned over here, that in case of obesity it causes the increase in the duration of the block. So I hope it is clear. Let's look at the other points too. So what happens in case of intraocular pressure? No change in case of IOP, that is intraocular pressure. So VECURONIUM can be safely used in case of ophthalmic surgeries where the choline is contraindicated due to its increasing IOP tendency. So I am repeating it for once again, please listen it carefully, that there is no change in case of IOP, that is intraocular pressure. So due to this reason, VECURONIUM can be safely used in case of ophthalmic surgeries where succinylcholine is contraindicated due to its IOP tendency. So please have a note of it, and do remember this point that succinylcholine have an increasing IOP tendency. VECURONIUM crosses the placental barrier, so it should be used very safely and very cautiously in pregnant females. And the last point over here, that in case of malignant hyperthermia it causes prolonged blockade. So I hope you enjoyed my lecture. on VECURONIUM. Slowly we'll be covering all the topics. Till then, keep watching, keep learning, and if you are new to my channel, please do subscribe to my channel. Take care. Bye bye.